Welcome again to the 12th webinar under Healthcare Insight series of Healthcare Sector Skill Council, which we regularly do almost every month with our industry partners, with highlighting the very important topics which is much needed for the skilling, upskilling, and reskilling of the healthcare workforce, and not for the only healthcare workforce, but also to spread awareness for common healthcare issues, which is very valuable for following in our daily healthcare practices. Today we have our prestigious speaker, Mr. Arvindd Narayanan, who is business head, acquisition, training and certification at Grandage Services Private Limited, in short form Vinage, which is a valuable organization who is delivering the geriatric age care giving practices, providing the home caregivers for healthcare services, and also to take care of especially our much needed patients or the geriatric group age group or the old age group at our homes. Welcome, Mr. Arvindd Narayanan.
Thank you, Dr. Megha.
Thank you, Mr. Arvindd. Mr. Arvindd is having a professional journey of nearly 3 decades. He has worked closely with government departments, corporate organizations, NGOs, and international development bodies such as the Global Fund, UNICEF, UNHCR, and UNESCO, and also contributed in the business operations and social development in various fields, especially the healthcare, education, skilling, and community development. So I hope with much needed insights from Mr. Arvindd Narayanan, we would be able to provide you an insight on our very important topic for today's webinar, checklist of a home caregiver and qualities of a good home caregiver. So over to you, Mr. Arvindd Narayanan.
Thank you. Thank you very much, Dr. Megha. And thank you, Health Sector Skill Council, for organizing such insightful webinars for all the participants. I think this is 12th of the series, and all the previous series must have really gone very nice. It's also very heartening to know that, it's reaching the audience right from students to professionals, and they can hear about what the industry has to say about, the present trends in healthcare. So thank you very much. Would you want me to continue in Hindi, English, or Hinglish?
I think so you could use the mix of both.
English then.
Yeah.
Hindi and English.
Yes.
All right, great. Okay, I have a small PowerPoint presentation. Can I share it here?
Go on, Mr. Narayanan. Floor is yours.
Okay, all right.
And audience, please do hear him properly. We could have poll questions and other questions for you at the end. And please keep a note of all your queries. We would take it at the end. Thank you.
Thank you so much. Okay, so before I want to just set the context about, what is a caregiver and what we are talking about here. So caregiver can be interpreted in many ways. So the definition I have given below in the slides. But before that, I want to specifically say that this particular session is going to talk about caregivers in elderly context. ये जो हम बात कर रहे हैं अभी, ये caregivers की बात करेंगे, जो caregivers जो बुजुर्गों की देखभाल करते हैं, उनके लिए बात करेंगे अभी. नॉट एनी अदर केयर गिवर, क्योंकि बच्चों को देखभाल करने वाले भी केयर गिवर कहलाते हैं, और जो नॉर्मल पेशेंट्स हैं उनकी देखभाल करने वालों को भी केयर गिवर कहते हैं. Right, so we'll be covering these topics today. Who is a caregiver? Qualities of a good caregiver. Types of caregiver. Types of care, not caregivers. Types of care. Caregivers trajectory. This is a very important topic. Caregivers trajectory, which talks about how a caregiver, starts his journey and what happens when he or she passes through the client and, when the client moves away. So we'll talk about that also. We'll talk about caregiver's responsibility. Caregiver को क्या-क्या करना चाहिए, उसका क्या काम है, उसके बारे में बात करेंगे. Caregiver जो दो जगह पर मोस्टली रहते हैं, एक अस्पताल में और एक घर पे, उनके बारे में भी हम बात करेंगे. So before we move further, I want to talk a little bit about my company. I'm from a company called Vinage, as the name suggests, Win plus Age, which means Umr Pe Jeet. So Vinage is a service brand of Grand Age Services Private Limited. That's the main company. And the company works in the elderly care space. We not just offer care, but we don't offer just human resources, but also offer care with that. Our mission is basically to create a multi-layered cadre of caregivers to help elderly segment who to make them socially relevant. We employ human resources connecting elderly to the mainstream with a focus on physical, mental, and social needs. Right. So our vision is basically to develop knowledge and skills and to keep elderly population socially active for extended periods with physical, social, and psychological assistance. How are we different? There are a lot of other companies also doing the same job. How are we different? We put the smile element first, which means that whenever Vinage reaches out to the clients or to anybody, we ask our caregivers to present themselves with a smile and make the same smile transfer to the patient. जो हंसी और खुशी उनके caregivers के चेहरे पर है, वही हंसी खुशी हम चाहते हैं कि हमारे क्लाइंट्स जिनकी वो देखभाल करने के लिए जा रहे हैं उनके चेहरे पर भी आए. At Vinage, a caregiver's career progression is also very important. We have developed a knowledge ascent program wherein the caregivers are encouraged to opt for additional skill training, which means that बुजुर्गों की देखभाल करते करते उनके स्पेशलिस्ट डिजीज जो होते हैं जैसे डिमेंशिया हो गया, अल्जाइमर्स हो गया, इन सब के बारे में भी स्पेशल ट्रेनिंग्स होते हैं. दोज केयरगिवर्स हु हैव स्पेंट टाइम विद अस, जैसे फॉर एग्जांपल 1 year or so, they are offered these special trainings, in-house trainings done by experts from the industry, and then they know more about how to handle a specific disease patient in geriatric care. So this helps these caregivers to acquire certain specializations, which enhances not only their skills and knowledge, but also their income, right? In fact, the knowledge which they are gaining stays with them, and this goes on to other organizations or wherever they move forward. We also, there is a value-added learning for domestic and overseas opportunity. So we have partnered with knowledge institutions to develop special training programs that have universal relevance. This helps the caregiver to deal with complex medical conditions of the elderly and other ailing people, things like palliative care, dementia, degenerative disorder, and diseases. These are some special modules which we have developed and are developing more. Right. So the idea of setting the context was that we are a company who are wholly and solely dedicated to the cause of elderly care, and hence caregiver as a topic is very close to our hearts, and we really feel about how a country like India, which has a very huge demographic potential, can use its human resources more wisely in terms of giving care to the elderly. So the elderly population is also increasing. And on one side, we see that we say there is no employment. So these two can also be matched going forward. Okay, coming to the topic, who is a caregiver and what are the different types of caregivers? So do you think that a professional who is taking care of a senior 24/7 is called a caregiver? Or do you think that someone who can deal with physical things like washing, cooking, giving medicines, taking them for a walk, they are called caregivers? Or do you think that someone who's hands-on with a person with disability, for example, taking care of a person with disability, like he can't walk or he has no arms, a person who's taking care of these people, do you think that they are caregivers? Or someone who provides care during the aging process or when the person is aging, they are called caregivers. So to answer this huge question, it's all of them. A person who takes care of any other person in general is called a caregiver. A person who gives care to any other person in layman's language is called a caregiver. And all of us at certain point in time, हम सारे के सारे एक टाइम पे केयर गिवर बने हैं, अपने दोस्तों के लिए बने हैं, अपने घर वालों के लिए बने हैं, अपने रिलेटिव्स के लिए बने, मे बी दूसरे भी हमारे लिए केयर गिवर्स बने हुए. Now, coming to specific context of caregivers in elderly. So, what are different types of caregivers? We have family caregivers, wherein the caregiver is specifically inside the family, and he or she is taking care of family members only. For example, a son taking care of his ailing father, a daughter-in-law taking care of her ailing mother-in-law, and vice versa. There can be many examples. Even a grandchild taking care of his grandmother or grandfather can be a family caregiver. There are professional caregivers who, for example, they learn this profession, like the courses which Health Sector Skill Council conducts, like what the government of India also conducts on caregiving. They learn this course, they are certified, they are trained, and then they become professional caregivers, wherein they offer their care services under a certain institution or individually to groups, individuals, or institutions. Professional caregivers can be seen in assisted living. Assisted living are places wherein you have many elderly population living under one roof, uh, where there are multiple caregivers taking care of them throughout the day and night. In fact, these people come and live there because they don't have any other people to take care of them at their homes. Skilled nurses. So professional caregivers can also be skilled nurses, GNMs, ANMs, higher level of nursing, because sometimes what happens is these people are bedridden and they need certain medical procedures which normal caregivers or the family caregivers cannot do. So that's where the skilled nurses come in place. Independent caregivers. These people are generally maybe trained or maybe untrained, but they are giving their services to whosoever they ask for a certain fee. They are mostly not associated with any institution. So they are independent people. They generally go in to networks and offer their services to people because they know certain things about caregiving. As I said, they can be professionals, which means that they are trained and certified, and they can be experienced, which means that they are not trained and certified, but they have been doing this for a longer period of time and they have been experienced. Private duty caregivers. So these people are basically professional caregivers, but at the same time, when they are associated with the institution for a certain period of time, in their free time, they give their services to certain people outside their organization. For example, if they are associated with the hospital and the hospital duty timings are from, 8 to 5. So they will give their services to somebody who asks from, let's say, 7 to 10 or maybe 7 to morning 7. So they are called private duty caregivers. Volunteer caregivers. So if आप लोगों ने रतन टाटा के बारे में सुना होगा, रतन टाटा की एक छोटी सी कंपनी थी जिसको एक बहुत ही यंग फेलो चला रहे थे, उनका नाम है शांतनु. उस कंपनी का नाम है गुड फेलो. सो दे वर्क ऑन द कॉन्सेप्ट ऑफ वॉलंटियर केयर गिवर्स. इसमें क्या होता है कि स्कूल्स और कॉलेजेस में जाकर लोगों को मोबिलाइज किया जाता है, उनको ओल्ड एज इश्यूज के बारे में बताया जाता है, और ओल्ड एज इश्यूज के बारे में बता के उनको बोला जाता है कि आप यू कैन वॉलंटियर, कम एंड वॉलंटियर at any old age home or any institution and become caregivers. So they are called volunteer caregivers. So to speak, a person who provides direct care, जो मैंने अभी बताया, a person who provides direct care as for children, elderly, or chronically ill is called a caregiver. This is a very simple and a very colloquial definition of who a caregiver is. Right. Qualities and traits of good caregivers. क्या विशेषताएं हैं एक अच्छे caregiver की? First of all, show empathy. Empathy क्या होता है? Empathy सहानुभूति है. अगर आपका दोस्त या आपके घर पे कोई भी किसी को चोट लगी है, कोई बीमार है, और आप उनकी जगह पर अपने आप को रख के देखते हैं कि उनको कैसा लगेगा, हाउ दे फील, if how are you connected to them. So that's called empathy. Empathy and sympathy में difference है. there is a difference between empathy and sympathy. Empathy means to feel what they are feeling. Sympathy is just doing lip service, which means that you say, oh, you're ill. Okay, okay, take care of yourself, and you move away. But when you empathize with certain people, you understand their problem, you spend time with them, and you try to solve the problem. A caregiver, a trait of a good caregiver is also that they are able to take up responsibility and are passionate about what they are doing. एक अच्छा caregiver responsibility उठाते हैं, अपने आप से चीजें करते हैं, दे आर प्रोएक्टिव, और जो काम करते हैं उसके लिए काफी वो पैशनेट रहते हैं. मतलब उनको ये नहीं करना होता ये मेरा अच्छा ये तो सिर्फ काम है और काम के लिए मैं करके छोड़ दूं. दे डोंट जस्ट कंसिडर केयर गिविंग एज वर्क, बिकॉज वंस यू कंसिडर केयर गिविंग एज वर्क, देन empathy and passion slowly moves away, which should not be the case, because a caregiving is something which requires human touch, because you are interacting with elderly people, and they are the ones who have done so much, and now they are moving towards higher ages. So they require people who can listen. They require people who can take care of them. So being responsible is one of a very good trait of a caregiver, and being passionate about what they are doing. Patience. So you have to be very, very patient when you are doing this work, when you are giving care to any elderly. The reason being that elderly are elderly people generally like to talk a lot sometimes, because they want to show, or they want to talk about what they have done in their life, talk about their experiences. They need somebody who can patiently listen to them. They need somebody who can patiently understand them. So patience is, again, as they say, patience is a virtue. So patience has to come to a caregiver, or a person who is very good in patience can be also termed as a good caregiver. Sometimes what happens is, if the patient is suffering with dementia or Alzheimer's, they tend to get aggressive sometimes. So at that point in time, we cannot just leave them. We have to be patiently working with them, because this is human interaction. This has to happen patiently over a longer period of time. So hence, patience is one of the very, very valuable characteristics of a good caregiver. A smiling face. Who doesn't like a smiling face? A person who has a smiling face in terms of when he faces the world, and even when he faces very discouraging situations, is definitely liked by many people. So a caregiver is a person who is going to give care to the elderly for a longer period of time. If he or she doesn't have a smiling face, and he or she frowns, so it automatically reflects upon the care receiver, and his or her health can also be affected due to this. Having said that, all these things are very good to have, but in real life, when you have a bad day and somebody asks you to keep a smiling face or be patient, it's very, very hard. So the job of a caregiver itself is a very, very, very tough job, and not everybody is made for this. Punctuality. Why do we say punctuality is an important trait of a caregiver? Is that when a caregiver is giving service to a person, as we spoke, that it is for an extended period, काफी लंबे समय के लिए caregiver अपनी services देते हैं किसी को भी. So जिस समय पे वो आते हैं, वो उस समय का बहुत ही महत्वपूर्ण, वो समय बहुत ही महत्वपूर्ण होता है. क्यों होता है? The reason being, every day जो बुजुर्ग महिला हैं या फिर पुरुष हैं, वो इस केयर गिवर का इंतजार करते हैं कि वो इस टाइम पे आएंगे और हमारे साथ समय बिताएंगे पूरे दिन. एक केयर गिवर का शिफ्ट कभी 12 घंटे का होता है और कभी 24 घंटे का भी हो सकता है. People have access to the whiteboard, it seems. All right. So punctuality की बात कर रहे थे हम. So when people are punctual, when the caregivers are punctual, they come to the person's place on time. क्योंकि वो उनका इंतजार कर रहे होते हैं, इस टाइम पे आएंगे और इनके साथ हम बैठ के बातचीत करेंगे या ये हमें केयर देंगे, बिकॉज दे आर लोनली, पीपल आर लोनली, सो दे वांट समबडी टू टॉक टू. So punctuality is a very, very essential quality wherein the caregiver, if he or she maintains, builds an exceptional bond with the person being cared for. Okay, with that comes the next point, which is a good listener and a good communicator and able to maintain confidentiality. इसका मतलब यह है कि एक केयर गिवर को एक अच्छा बोलने से ज्यादा सुनने वाला होना चाहिए. पेशेंस जिसकी बात की थी हमने, उसके साथ आता है कि एक केयर गिवर एक अच्छा सुनने वाला होना चाहिए. ये नहीं कि हर बात पे उल्टा बोले. उल्टा बोलने का मतलब ये है कि हर बात पे कुछ उनको दोबारा बोले. सुनने की भी आदत डालनी चाहिए. और एक अच्छा कम्युनिकेटर होना चाहिए. अच्छे कम्युनिकेटर का मतलब यह है कि जब बोलना है तभी बोले, और जो पॉइंट बोला है उसको सही तरीके से बताए. एंड मेंटेन कॉन्फिडेंशियलिटी. कॉन्फिडेंशियलिटी का मतलब यह है कि अगर कोई बुजुर्ग अपनी कुछ पर्सनल बात बता रहे हैं इनको, बैंक के बारे में, पैसे के बारे में, जायदाद के बारे में, तो ये अपना जो कॉन्फिडेंशियलिटी है, ये बात किसी और को ना बताकर अपने तक ही रखें. तो ये एक बहुत ही इंपॉर्टेंट क्वालिटी है केयर गिवर का, कि वो कॉन्फिडेंशियलिटी मेंटेन करें. सो एक अच्छा सुनने वाला, एक अच्छा कम्युनिकेटर, जब बोलना हो तब बोलें और स्पष्ट तरीके से बोलें. टॉक विद क्लैरिटी, बीइंग अ गुड कम्युनिकेटर, एंड मेंटेन कॉन्फिडेंशियलिटी, कि जो बात अगर कही गई है उसको, तो वो यहां वहां फैलाए ना और अपने पास ही रखे. मल्टीटास्किंग. एक केयर गिवर का काम कभी आसान नहीं होता. सो व्हाट हैपेंस इज, the day starts with, let's say, waking the person up and then maybe taking them to the washroom and stuff like that. So the day is set. पूरे पूरे दिन का एक दिनचर्या बना हुआ होता है केयर गिवर का, कि क्या 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 किस किस तरीके से कब कब करना है. तो उस बीच अगर कुछ भी और चीजें हो जाती हैं, तो केयर गिवर के पास एबिलिटी होनी चाहिए कि वो चीज भी करे. सो मल्टीटास्किंग. फॉर एग्जाम्पल, अगर उनके क्लाइंट या फिर उनके जो केयर रिसीवर हैं वो सो रहे हैं, तो उनके पास ये होना चाहिए कि मेरा अगला काम जो है उसके लिए मैं प्रिपेयर करूं. सो वो काम भी पैरेलली करते रहना चाहिए. सो एबिलिटी टू मल्टीटास्क इज ऑल्सो वन ऑफ द गुड ट्रेट ऑफ अ केयर गिवर. थिंक क्विकली एंड इज अटेंटिव. इसका मतलब ये है कि वो हमेशा क्विक विटेड और प्रोएक्टिव रहता है. प्रोएक्टिव का मतलब यह है कि पहले ही सोच के रखता है चीजें होने से पहले. ये नहीं कि हुआ और फिर हम रिएक्ट कर रहे हैं, उस पे नहीं. अच्छा, मतलब अगर कोई भी परिस्थिति आ जाती है तो उसमें सोच उसकी जो है वो काम आती है. ये नहीं कि बैठा हुआ है, अच्छा घर पे मान लीजिए गैस की दुर्गंध आ रही है, अरे मेरा काम तो नहीं है भाई, ये मैं तो बैठा ही रहूंगा. तो नहीं, नहीं चलेगा. घर पे अगर गैस की स्मेल आ रही है, इसका मतलब किचन से आ रही होगी या कहीं कुछ लीक हो रहा होगा. तो फटाक से अगर उठ के वो देखे, ही और शी गोस एंड चेक्स if there is a gas leak in the house, that shows that they are quick witted and proactive. अटेंटिव रहना है, मतलब अपने जो सारे इंद्रियां हैं उसको खुली रखनी है. एंड कान से सुनते रहना है कि कोई ऐसी आवाज तो नहीं आ रही जिससे कि हमारे पेशेंट को कुछ प्रॉब्लम हो, या फिर ऐसी कोई स्मेल तो नहीं आ रही जिसके जिसके लिए घर पे कुछ या हॉस्पिटल में कुछ किसी को बताने की जरूरत है. तो दे हैव टू बी अटेंटिव ऑल्सो. विलिंगनेस टू लर्न. हमें ये नहीं लगना चाहिए एक बार हम काम पे आ गए हैं तो हम अपनी पढ़ने और लिखने की क्षमता बस हो गया, अब कुछ नहीं, अब तो मैं काम करती हूँ या करता हूँ, अब मेरे को पढ़ना लिखना नहीं. ऐसा नहीं. काम करते हुए भी आपको सीखना है. सीखना जो है ये कभी खत्म नहीं होता. चाहे बुजुर्ग हो जाएं आप, तो आप सीखते ही रहें, तो आपके आपके लिए और आपके मस्तिष्क के लिए अच्छा है. इट्स अ गुड थिंग टू लर्न ऑलवेज. Because what happens is, more the information you get, the more wiser you become, and the more better you can process actions. आपको जितना इंफॉर्मेशन आपके पास आता है, उससे आप नॉलेजेबल बनते हैं. नॉलेज से आपका एक्शन जो है वो भी अच्छी तरीके से डिफाइन होता है. तो हमें ये नहीं लगना चाहिए, वी शुड नॉट फील दैट ओके आई एम नाउ एट अ जॉब एंड आई शुड स्टॉप लर्निंग. So willingness to learn is also one of the important characteristics of a good caregiver. Willingness to go extra mile, be flexible. अभी हमने बात की थी घर पे गैस का अगर छोटा सा स्मेल आता है, तो अगर केयर गिवर बोलता है भाई ये मेरा काम तो नहीं है, मैं किसी को बोलूंगा भी नहीं और ना मैं किसी को कुछ बताऊंगा इसके बारे में, तो वो गलत है। विलिंग टू गो एक्स्ट्रा माइल मतलब अपने जॉब रोल से अगर वो हट के भी थोड़ी चीजें कर लेता है। फॉर एग्जाम्पल अगर लाइट हाउस कीपिंग कर लेता है, आसपास की जो पेशेंट है, पेशेंट एरिया को क्लीन रखता है, पेशेंट के लिए हल्की सी चाय बना देता है, कभी कभी दलिया गर्म कर देता है, दीज आर ऑल एग्जाम्पल्स। अगर थोड़ा सा वो एक्स्ट्रा करता है तो उससे बॉन्डिंग पेशेंट के साथ जो है वो बढ़ती है, क्योंकि यहां पर हम ह्यूमंस के साथ डील कर रहे हैं, वी आर डीलिंग विद ह्यूमंस हियर। So the whole point is that we make the care receiver comfortable, A, by going some extra miles. Sorry. Okay. Types. In home care. So जो केयर गिवर होता है मोस्टली ये लोग होम केयर करके एक हमारा एक अलग टीम है। होम केयर के अंदर जो व्हाट हैपेंस इज the caregiver is at home and he or she is providing services at home. So it can be a 24-hour shift, it can be a 12-hour shift. Uh, Either ways it can go. So a caregiver who provides services, excuse me, at home is called a home caregiver. Adult daycare, as the name suggests, daycare means in the morning. So people leave their parents or relatives in the daycare in the morning, and they are taken care by the caregivers there, and then they are taken back again to their own places in the evening or night. Respite care. Respite care is also, to take care when, for example, cancer patients or somebody is there. So to take care of them, caregivers are there. That's respite care. Assisted living facility, residential centers. We already spoke about this. Assisted living facilities are institutions where old age people come and live together because they don't have anybody to take care of them at home, or they need specialized care, which can be given at assisted living facilities. Skilled nursing care and rehabilitative care. This is also one of the specialized care wherein the care receiver needs specialist care, which can be given only by skilled nurses or rehabilitative people like physiotherapists and all. Personal care, uh, dementia care. Dementia care is very specific. We have now in India dementia homes, which take care of people who are suffering from dementia. These are specialized homes which have specialized caregivers who are trained on how to handle people suffering with dementia. These caregivers are also, they are something extra than the normal caregivers because dementia is also a progressive disease, and as the disease progresses, the care required is also, multifolds. Hospice or end of life care. Hospice is a place where excuse me, a person goes during the end of his life when they know that they are terminally ill. So care over there is called hospice care. Okay, this is an interesting thing. This is a caregiver's trajectory. This is borrowed, or this is an adaptation from Letlin and Schultz. We have taken this particular diagram from there. This is a very interesting diagram. I'll just explain it in a moment. So what happens is when the caregiver comes in to any particular client or any particular home, he gets aware. So the first stage is awareness about what he has to do. Uh, Generally, okay, this is a person, this is a male age 72. I have to take care of him. I have to run light errands for him. For example, take him for a walk, go to his bank and stuff like this. So awareness about what the caregiver's service is going to be happens at this particular stage. During this stage, there is sporadic care, as in this usually lasts around a week, wherein he or she, the caregiver, does things like checking the patient's vitals, communicating with him properly, and communicating with his or her family members and also physician about his condition and stuff like that. The second stage is unfolding of responsibility. Unfolding of responsibility is he or she takes care of, his tasks properly, the care receiver's tasks properly. For example, a schedule is set. So the ये जो आप देख रहे हैं, this is a Western example, but more or less this is also applicable for Indian context. So when the responsibilities set in, he or she makes a schedule, and in that particular schedule, it shows every, for example, hourly detail or daily detail about what the person is supposed to do. Does he have to coordinate with somebody? What kind of emotional support is to be put? So all this is happens in the unfolding of responsibility stage. Increasing care demand. So around a week, 10 days, or a month. After that, what happens is increasing the care giver has to give more now. So he or she gets into, for example, उनके लिए ड्राइविंग कर रहे हैं, उनको कहीं लेके जा रहे हैं, or maybe he or she has to take him to the physician, maybe in an emergency situation. When the care receiver is hospitalized, they have to stay in the hospital. So the care demand is increasing. So that is the next one. So, and then what happens is this is for people who are taking care of people who actually pass away. So next comes end of life. So if the care receiver or the geriatric patient, happens to pass away, that is where the end of life thing will come, and that is where the caregiver also gets into a psychological mode wherein he or she, because the attachment with the care receiver has been there for so long, let's say 3 months, 6 months, a bond has developed between the caregiver and the care receiver. Now, how does the care giver react to this end of life? So he or she does, some kind of a planning. When he or she knows that they are going to leave, maybe in a month or so, they will probably take care of, advanced planning, things like telling their families about what happens during this particular time, or maybe telling their families to take care of his or her assets and stuff like that. Maybe the care receiver is also suffering a lot, internal pain. So how a caregiver resorts to giving more and more support in terms of end of life. Bereavement is a stage wherein the caregiver is actually psychologically shattered. So personal care of the caregiver is very, very important. Why I'm showing these stages is this is a general thing wherein a caregiver, this is what a caregiver experiences during his care life cycle. Right? You can break this down. We can talk about each stage differently in Indian context, but this is how the stage progresses. Yeah. Okay. A caregivers. Can I request people not to please write on the screen? It's actually distracting me. Thank you. Okay, caregivers' responsibility. As the caregiver's domain suggests, they have to be, there are certain activities and tasks which define what a caregiver does, right? In his or her domain, self-care is also very important. Only when a caregiver takes care of himself or herself will they be able to provide proper services to the client. So self-care is very important. Supervision and mobility. They have to look at the geriatric patient if when they are walking and what they are doing. So rather than just being with them or maybe touching them or doing thing all the time, they can just supervise. They can just look at them and observe what they're doing. Bathing and grooming is one of the very, very important things which part of the caregiver's responsibility. Dressing a patient, feeding them, management of behavioral symptoms, very important. As I said, patience is a very, very important thing which each and every caregiver should have. So mood swings are very, very common in older adults, wherein sometimes they will feel low, sometimes they will feel high. How does a caregiver handle these situations? Management of behavioral symptoms. So that's also caregiver's responsibility. Elimination needs, diaper changing, incontinence, going to the washroom, etc. This is taking the patient to the washroom is also part of caregiver's responsibility. Transferring bed to wheelchair, wheelchair to bed, or elsewhere. All these are caregiver's responsibility, where he or she is taught on how to do this in a very scientific manner. Help to get the patient around the house. Walking, if the patient is immobile, how to take care of the patient while he or she is immobile, how to help the patient in walking a little bit. All these are also part of his responsibility, his or her responsibility. Now, apart from this, major responsibility is also a psychological responsibility. Goes without saying that since the caregiver is going to stay at the patient's place, providing emotional support to the patient also becomes very important. एक caregiver को एक care receiver के साथ जो वो काम कर रहे हैं, उनको साइकोलॉजिकली भी उनको सपोर्ट करना बहुत बहुत जरूरी है. उनके साथ रहना, कंपेनियनशिप, प्रोवाइडिंग कंपेनियनशिप, डिस्कसिंग ऑनगोइंग लाइफ चैलेंजेस विद केयर रिसिपिएंट. आपको कैसा लग रहा है, आप जिस तरीके से आपकी उम्र बढ़ रही है उसमें ये परेशानियां आ रही हैं, तो ये दिक्कतें आ रही हैं, हम इसको मिलके पार करेंगे. सेइंग दीज एनकरेजिंग वर्ड्स टू द एल्डरली पॉपुलेशन actually creates a lot of positive psychological boost to that. Facilitate and participate in leisure activities, light sports, maybe board games or carom, chess and all, walking, taking them around the house, etc. All these are leisurely activities. Cultural evenings, which are organized by either RWAs or maybe at homes. So this also makes them very, very, this kind of emotional support is also one of the responsibility of the caregiver. Help manage emotional responses. So this is a very integral part wherein we talked about mood swings of the elderly people. How does the caregiver manage the emotional response of any care receiver is also one of the important responsibilities, which requires a lot of training, a lot of patience, a lot of understanding on part of the caregiver. And of course, troubleshoot problems. We spoke about one of the important aspects of the caregivers as being agile, being quick-witted. So troubleshooting, any problem comes, they have to be on their feet to solve the problem. Health and medical care. So they have to encourage the care receiver to have a very healthy lifestyle, encourage self-care. They also have to encourage the care receiver to be neat and clean, to have a healthy mindset, encourage treatment adherence. For example, any kind of medication and things are given, so they should encourage the care receiver to basically take the medication and all. Encourage manage and give medication pills, etc. We spoke about this. Operate medical equipment. There are certain care receivers who have special medical equipment in their houses. So the caregiver also needs to know how to operate. If he or she has not learned it, he or she has to learn it from a person who already knows about how to operate and then start operating this. Prepared food or special diets. So if a person is diabetic, how to ensure that if nobody is at home, he gets the right meal is also very important. That also forms a part of the responsibility of the caregiver. Respond to acute needs and emergency. For example, BP shoots up or sugar shoots up while checking the vitals. He or she should know which doctor to call or what happens in case of emergency. So they should be able to take them there. Provide wound care, small cuts, bruises, wounds, they should be able to, provide care for that. Advocacy and care coordination. So this forms a very important part because in this particular part, the caregiver is actually trying to move move into a network, because caregiving is not an individual's job. It only happens with the support of the family members or physicians. Right. So it's very, very important for the caregiver to have all the information. So seek information. जो इंफॉर्मेशन चाहिए वो मांगे लोगों से, डॉक्टर से मांगे, घर वालों से मांगे कि भाई ऐसे अगर होता है तो क्या होता है जनरली, क्योंकि वो लोग रहे हुए हैं उनके साथ पहले. फैसिलिटेट पर्सन एंड फैमिली अंडरस्टैंडिंग. Communicate with doctors, nurses, social workers, pharmacists, and other healthcare long-term service providers. So basically, this says that basically this talks about communicating with the healthcare facility people on understanding whether the patient needs are truly met or not, or if there is anything else which the caregiver should do to make the patient comfortable. Locate, arrange, and supervise nurse, social worker. So if the patient is admitted to the hospital, the caregiver's duty is basically to stay there and arrange for coordination, if because he is not authorized to do any intrusive techniques with the patient. So it is the doctor or the nurse who has to come. So in case the caregiver feels that there is a need for the doctor to come there, he should go and call. He should go and call them immediately. Make appointments, order prescription medicines. He is not authorized to prescribe. He can just order the medicines which are prescribed to them. This was what we spoke about is for caregivers at home. Now, the caregiver at hospital is basically also not that much which is there at home, but it is basically to perform basic functions needed when the caregiver, when the care receiver is alone at the bed. Nurse is not there, doctor is not there, and the patient wants to use the washroom. That's the job of caregiver to take them, transport them in a wheelchair, right? Coordinate with the doctor. We spoke about that on any kinds of needs. Look at the medication. If the medication is has been given, what as per the prescription of the doctor and stuff. Caregiver at the hospital is also considered to be part of the overall healthcare team. Now, he or she should be helping the doctor and the nurse in giving information about what the patient has done in the absence of the doctor or the nurse. For example, if he is the person who is going to change, he's the person who is going to change the, let's say, urine bag. He has to show it to the doctor or the nurse in case he notices any kind of color difference in the urine. So if he does, then he is actually providing additional information to the doctor for either changing or reducing the prescription drugs. Reaching out to the nurse. The caregiver is basically the person who is going to be with the patient for a longer period of time. He or she should reach out to the nurse as soon as he or she feels that the patient needs them. So this is at the hospital part. Talk with the attending doctor often, though the attending doctor might be a very busy person. So whenever he or she comes, try to listen to at least what they are saying and ask the doctor if there is anything else which they as a caregiver can do. Have a list of running questions. So the caregiver, he or she can have a list of questions written down. So as soon as the doctor or somebody comes, they can ask them about, okay, if this happens, what is to be done? Or last night he didn't have the dalia fully. Is there anything which we can do now? Stuff like that. So make observations, write notes, and then ask the healthcare team about how to go about. Meet the hospital social worker or the case manager in case of there is financial support which is needed or anything which is needed. So some hospitals have social workers, and make an appointment with them and make the care receiver meet the social worker if that is the case. Get organized, uh, filling prescriptions, packing their bags up, and organizing to avoid feeling overwhelmed all the time, all the information from one hospital. So basically, the information has to be organized in such a manner that they don't feel overburdened with all the information in one time. Organized is also that when the caregiver and the receiver enter the hospital, they are having a bag with them with all the essentials which is needed. They are having all the medical reports with them which they can show to the doctor. अपने डॉक्टर को दिखा सकते हैं वो मेडिकल रिपोर्ट की ये चीजें हुई थी पहले. So ये all these small things consists of organizing, getting themselves organized. Caregiver at home settings is an important person, again, who's very much in charge. At the hospital, the caregiver is a person who's just assisting the healthcare team, but at home, he's the one who's in charge of everything because he's the one who's going to stay with the patient. A lot of responsibilities lies with the caregiver when he's at home. Psychological, emotional, and physical needs, everything is given by the caregiver at home. So assisting the patient in bathing, grooming, dressing, toileting, etc., exercising, basic food preparation, warming up cooked food or making light food is also part of his job at home. General healthcare, overseeing medication, prescription usage, appointment reminders, administering medicine is also part of his job. Mobility assistance, wheelchair to bed, taking him to the car, making him shower in the bathroom, etc. Personal supervision, providing constant companionship and general supervision. Transporting, as we talked about, running errands for the care receiver, getting the wheelchair ready or making the wheelchair accessible to the patient, etc. Emotional support, where all it is needed, be a good listener, be patient with everything. Orienting somebody with Alzheimer's disease or dementia. So, for example, if somebody has Alzheimer's or dementia, how and when to call the doctor in case of, if the situation gets out of hand, whom to call, writing down all the important numbers. Backup care, as we spoke about, as soon as the caregiver is very, very weak or very, very tired, who is there to back him up? So there has to be a person in the family or even at the agency. If they send, for example, if the caregiver has done continuous duty for 2 3 nights, or day in day out, so is there somebody who can relieve him? Because caregivers are also humans and they also get tired. Health monitoring, when they check the vitals, they have to write down the vitals every time. What is the BP? What is the sugar? Everything has to be written down. Medicine, prescription and administration has to be very, very smooth, and it has to be done as per the doctor's advice only, right? Inform elders when rehabilitation is needed, as physical therapy. For example, if there is a feeling that the care receiver needs a physiotherapy or his muscles are twitched, so informing to the family members that this is the case, you might first want to show him to a doctor so that they can consult and then give him physiotherapy if needed. Okay, that's it from my side. I will be happy to answer any questions, and I'm also open for any suggestions if you have any. Okay.
Hello, sir.
Hello, sir.
Hello. I am working with an NGO who are basically home-based geriatric care they are involved with. And with this work, we have observed that senior citizens more particularly attention. And for that matter, caregiver requires some skillful training and orientation with the geriatric problem and geriatric how to resolve all these problems. So I
Right.
thought, and at the same time, senior citizens have some problem with the furniture. If this is shifted quickly, they may find it problem in the night. So it is there also. That I thought some skillful training is very much important for caregivers, and a minimum educational qualifications is also required to acquire this knowledge also, sir.
Absolutely, it's a very valid point. Just to add to what you have said, India is as such facing a demographic dividend, and right now, by 2030, almost 25% of the population will be elderly. Now, when you say 25% of the population being elderly, now out of that 25%, there is a huge number which also is not capacitated to do work themselves. That is where caregivers come, and I think your NGO would be doing an excellent job. Are you also training these caregivers, sir?
Yes, sir. We do 1 year certified nursing assistant training, sir.
You're from West Bengal, sir?
Yes, sir. I'm from Calcutta.
Okay, so certified nursing assistant is a step ahead of caregivers, because this caregiver training, HSSC or other sector skill councils or even the National Institute of Social Defense offers for 3 months the basic caregivers training. So in that basic caregivers training, they focus on around 27 sub nursing procedures which are there. And these sub-nursing procedures range from mobility, transportation, feeding, hair care, nail care, all the caring patient-related procedures are there. Now, when you talk about, very rightly said that psychological and emotional needs are also there. So this requires a little bit higher level of orientation. And that is where, sir, the selection of a caregiver, or as you rightly said, the qualification of a caregiver, who is a caregiver matters a lot. So the caregiver needs to understand needs to have some basic education qualification. We recommend minimum 12th pass, but in exceptional cases, we also do 10th, because their levels are high. Right? Fluency and levels are high. We also have a small test which we take to look at their empathy levels, and are they able to do such kind of because this requires a lot of patience and empathy.
Yeah.
And today's, sorry to say, today's younger generation needs to have them more. Yeah.
Exactly, sir. Particularly middle level intelligent people, if they get this training, they will get the financial support from their own profession. They do not go through for a job here and there, etc., etc. Our
Absolutely.
trained our trained personnel, they are already involved. We don't
Correct.
get their service.
So
It is
what we also recommend, sir, is that this 3 months training can also be taken by any family caregiver. So any family person can also take this training, so that if caregiver is not available, at least for some period of time, they can give the care scientifically and properly. Right.
right,
Though,
right.
though we are trying to, increase the number of caregivers, because a lot of training happens, but the translation from training to a job is very less. And
Activity,
the
training to
the
activity.
right, right. So the the translation is very, very less, but it's the industry problem. It's not any one particular person's problem. I think what our recommendation would be, or what we are doing ourselves, why should I recommend? We are doing ourselves is that we are putting a lot of emphasis on how we select the caregiver during the training.
Exactly.
Rather than focusing on numbers, we are actually focusing on the quality of the person, so
That
that
is very
he,
important, sir.
right, sir, absolutely,
Mm,
so that he or
mm.
she understands what they are meant for, and they deliver the care properly to the care
True,
receiver.
true, true. That will be fine. And we are also asking for HSSC's suggestions, advice, so that we can conduct small courses also. That is, we also have require their assistance.
Sure. I think HSSC also has, Dr. Megha is here from HSSC. I
Ah,
think they also have a short-term course on caregiving. They have a
mm,
QP NOS on caregiving also. They'll be able
right.
to better tell you about this.
Okay. Thank you, sir.
Thank you very much, sir.
Mm, may I add something, sir? I mean, Dr. Dhiresh Chaudhary from Kolkata.
Sure, Dr. Chaudhary.
Yes, first of all, thanks for that your excellent deliberation and very meticulous. One point, as per my experience for more than 2 decades, especially in the geriatric sector. So whatever the problem is, one is the perception of the caregivers from the beneficiaries aspect, as because beneficiaries, they their expectation is much more from the caregivers, which are not relevant to their work also. They are actually asking that sort of jobs which are basically for the house workers or home workers, the jobs. These are not jobs of caregivers. So in that aspect, that confusion, confliction is going on. And another one thing, that is caregiver, whoever is work as a caregiver, they should know the family structure, the cultural and even the religious beliefs, cultural things, cultural structure of the family, even also the language, because in that aspect some confliction is going on. That they don't know the food habits, they don't know the cultural beliefs, but they are giving their services. And even intellectual component, one another very important aspect, that is intellectually maybe sometimes the caregivers are not on that intellectual level that that person or that beneficiaries are expecting. So this sort of confliction is very much going on. Okay, so that's why you have rightly mentioned that caregivers are actually just below the nursing level, what we are expecting. So that's why minimum 12 standard is absolutely mandatory. Otherwise, 8 pass, because now the educational level is so below one level, so they don't have even minimum knowledge of even the anatomical, physiological, no knowledge absolutely. So that's why the caregiver, if we want proper caregiver, those who are in between the nursing, who actually maintain the liaison between the nursing doctors and the patients, or whatever we say, the members, or whatever with the geriatric people. So that minimum basic orientation is absolutely necessary, what you have mentioned in your deliberation. Thank you.
Dr. Chaudhary, very well point made. I think you have dwelled upon something which is very close to my heart also. So what we have done at our organization is we have a caregiver's checklist wherein we match the caregiver with the care receiver, with the geriatric patient, wherein, as you rightly suggested, the language, height, the weight, cultural orientation, even fear of pets are pointers which we match with the person who is going to receive care. And I mean, sometimes we have to refuse care because we have caregivers, but they are not matching as per what the client is or what the client wants. So religious preferences are there sometimes. Sometimes, they say that the patient's height and weight is more, and we can't send a puny caregiver because he might not be able to take care. So we would have to politely refuse all these things. So very well point made, sir. Yeah. And as for the education qualification, I think all of us in the industry, including experienced people like you, should always strive for having higher qualities. When we make ourselves lower in terms of quality, and that is where things start creeping in and things start going haywire. So when we say we will only recruit this particular person with this particular attribute, we should stay with that, because caregiving is a very big industry and right now it is unregulated. At the same time, there is huge scope for improvement and huge scope for service delivery in this. So, and I'm hoping that in the near future, more and more reliable and good organizations, some organizations are doing really good work here. More organizations come in, because this sector needs a lot of, a lot of people who understand what the sector is, what the kind of repercussions it will have on our economy also. Yeah. So thank you very much for your points.
Thank you. Thank you.
Any further questions from anyone? Thank you so much, Mr. Arvindd. That was very informative, and um, not as only the professional from healthcare sector skill council who are working day and night for all these caregivers, training of caregivers, but also as a part of a human being, because we got really insights that how we should take care of our family members, because you are rightly said that at any point of time, we all have required our caregivers. We all have worked as caregivers, and but yes, to all of you, we have for the professionally, if someone wants to take up the course of caregiver, we have many courses. For hospital side, we have the general duty assistant. For home side, we have home health aide. For specially elderly care, we have the geriatric caregiver, geriatric care assistant. And there are many other roles, general duty assistant advanced for the specialized sites. And we are going to come up with much more as well. So we have a plethora of courses. You always can go to our website, go to the qualifications tab and explore the courses. And you could register your organization as training partner. You could register yourself as trainer. You could motivate others to become the caregivers, or you can also post your requirements, and we could obviously we will come back to our industry partners like Vinage to provide them the professional caregivers for their own services. We usually do that kind of stuff as well. So you all could connect to us back. Thank you very much. Thank you so much for your insightful session, Mr. Arvindd. And thank you so much, audience, for joining in and listening peacefully and patiently.
Thank you, HSSC, and thank you, Dr. Megha, for conducting this very, very nicely. Thank you.
Thank
Thank
you.
you, the audience.